This Wellness Wednesday, we are discussing psychedelic drugs. In a recent Reuters article, former heavyweight champion Mike Tyson credits magic mushrooms for saving his life and hopes that psychedelics can be used to change the world. Well, our next guest, Candace Oglesby, is a psychotherapist as well as the founder and owner of Journey Mental Health Consulting, LLC, and she joins us to talk about the possible health benefits of psychedelic drugs in mental health treatment. It's good to see you. Thanks so much for being with us.
Thank you, Holly, for having me here. I'm just elated to be here. Thank you.
So let's talk about how this really can be beneficial, because I think sometimes it's somewhat confusing, right? Because we hear about, people doing mushrooms and all of a sudden they get anxious and they get, you know what I mean? And yet in this case, we're talking about maybe it's an answer to anxiety. So kind of explain the difference for me.
So, typically when we think about psychedelics, right, we think about party drug, right? But as research has shown, as psychedelics is in its renaissance phase, is that the set and the setting is important as it relates to mental health, right? So the set is, right, you're not doing this at a raid, but you're in the therapist's office or you're in a clinic. And then, you have this magical journey, you have this experience where these insights and these awarenesses are coming, but then there's also the set, right? So when we talk about the integration portion, so it's not like, you have this experience where you come to these insights and awarenesses and someone sends you off, but there's a therapist that's actually sitting with you, helping you to be able to actually integrate the information that has come from this journey or this trip and being able to actually integrate into your daily functioning, and which actually helps to be able to resolve the depression and the anxiety and mental health symptoms thus far.
Yeah, that makes sense to me. I also want to talk about the amount, right? Because, it's just not this wholesale, do as much as you want till you feel whatever. Again, someone's with you and they're monitoring. I'm assuming this is a lot less amount than what people do when they use it recreationally.
Yeah, so of course, when you buy, right, these drugs off the street, you don't know what you're getting, right? But we're talking about synthesized psychedelics that comes in milligram form, right? And you actually know what particularly you're getting, right? So when we talk about ketamine dosage, when we're talking about psilocybin, as far as the clinical trials, usually, there is open label clinical trials where you actually know what the dose you're going to be getting, which is around 25 milligrams and thus forth. But of course, when you're out in the street partying, you don't know the milligram, you don't know what is actually being put into the drugs, which again looks a little different when we talk about the medical system and the mental health system and that setting and actually kind of knowing the experience that you're actually going to get from this.
How do you go about finding someone that you can trust to take you through this experience the right way?
Right. So, of course, you want to find a therapist that has been trained. There are a lot of ketamine clinics that have opened. Ketamine is actually FDA approved psychedelics. So you do your research just like you would with any professional, just to see what their training is, how long they've been doing this work. But then also, too, when we talk about, right, clinical trials and things of that nature, there's all sorts of professionals that work in these clinical trials. So you have doctors and you have psychiatrists and you have therapists. So these are all trained professionals that have been trained to essentially do this work.
What do you say to the people, though, that say, well, I'm afraid of getting addicted?
So when we talk about psychedelics, they have low addiction qualities, right? And so that's one of the key pieces, is that, knowing people that they can take this medicine safely, but also know that they have low chances of becoming addictive on these healing medicines that have been around for centuries.
It's interesting, though, because when you ask people and, poll people, they're totally fine with making marijuana legal, but they're more reticent to make psychedelics legal. Somehow they don't make that leap. Why do you think that is?
Well, I think there's a lot of stigma that's still attached to, when we talk about psychedelic medicine. But because psychedelic medicine is in its renaissance phase, there's more research that's been done on psychedelic medicine, and hopefully will decrease that stigma that's been attached to these healing medicines.
Now, is it something like once you start it that you would just have to continue it, with no end, or is it something like you do a series of treatments and then you're okay?
So you can do a series of treatments. When we talk about integration, right, this work can take years to integrate. And usually when you have a psychedelic experience and you have a journey, you want to let that information take its time to be able to sink in. You want to take the time necessary to actually integrate the information. And so usually, you know, there's a certain amount of dosage sessions that ketamine clinics do require that people get, but we're talking about 6 dosing sessions compared to maybe months or even a couple of years of therapy. So we're really talking about people being able to save time and money with this healing medicine.
Well, Candace, you certainly know what you're talking about, and we sure do appreciate your insight this morning. Thank you so much.